First of all, it's a formal, recognizable business metric that is used to deliver value to shareholders and stakeholders beyond what you would normally expect in business operations. It's a formal way of measuring what a dividend is and defining what a dividend is to the company. It also helps to formally acknowledge that employee health is both a cost to be managed as well as an investment that you want to see meaningful return on. And it helps companies to better articulate what value they'll derive from a culture of health. First of all, it's an approach to defining and realizing the business value associated with employee health. It needs to be company specific because each company has its own workforce characteristics, programs, and related investments in employee health. So you want to make sure that you're defining a health dividend that is really specific to the business outcome that we're looking to derive for that company. Lots of examples of the way companies are using health dividends and measuring health dividends today. First and foremost, what's the underlying cost to deliver the program? So that has to be central to the working definition, and that cost is both per capita as well as what the rate of increase to cost would be over time. But then extending beyond that, you can look at things like employee engagement levels, employee health outcomes, employee productivity levels, employee satisfaction levels. And when you wrap all of that together, you really have a more comprehensive definition that goes beyond the single dimension of looking at the cost of the program. Companies with high-performing health programs are realizing a health dividend for their business today. If you look at it in terms of employee cost advantage, the high-performing organizations are delivering comparable benefits for as much as $1,200 per employee less than that of non-high-performing organizations. They have lower employee contributions as well, on average about $325 per year per employee less, which again is a way of looking at the financial dimension of the health dividend that these companies are realizing. These companies also have employee populations who are more satisfied, competent, and accountable for their healthcare decisions and their experiences, and we're seeing a very significant differential there between the high-performing organizations and the rest, about 25 percentage points. And their employees are more engaged, and engaged employees really are delivering the discretionary effort that's required for the company to be able to hit higher levels of business performance.